Hello everyone, my name is Edgardo Hernandez and today I'm gonna teach you about how to assist in a Class 1 composite restoration. So first, let's define what's a Class 1 restoration. A Class 1 restoration is the one that involves the occlusal face of posterior teeth or the lingual surface of anterior teeth. To be more specific, is the one that involves the pits and fissures. So, as a dental assistant, we should always be prepared. We should always prepare the instruments and materials for the procedure. So, some of the instruments and materials are the basic setup and cotton rolls and the local anesthetic setup, such as the topic gel, topical anesthetic, the high speed, and make sure that the high speed and the low speed handpieces are in place, the HBE and the saliva ejector, the bonding, primer, and etching agents, the composite, some cutting materials such as the sponge excavator, the burnisher, and the articulating paper. So the first step on doing Class 1 restoration is preparing the tooth. So the first step is assisting placing cotton rolls for moisture control. In some cases, the dentist will ask for dental dam, but this is again depends on the dentist preference. Next, we should transfer the mouth mirror and the explorer to the dentist so he can assess the tooth being prepared. Next, we should assist in the anesthetic procedure by placing the topical anesthetic. The second step is preparing the cavity. So the dentist will start using the high speed, and we as a dental assistant, we should assist in aerosol control with using the HBE and the saliva ejector. At the same time, with these two instruments, we can help the dentist by clearing the field, making retraction of gums, of cheeks, or the tongue. Next, once the dentist has finished using the high speed, he might ask you for a sponge excavator to remove some caries manually. So the next step is placing the restoration materials. First, we should transfer the etching agent to the dentist and be ready with the saliva ejector when he rinses the etching agent. Next, we should transfer a microbrush applicator to the dentist, along with the primer agent. Once the dentist has applied the primer agent, we must use the curing light to set the primer. Next, we have to transfer a new and clean microbrush applicator to the dentist so he can apply the bonding agent. Once he has applied the bonding agent, again we must use the curing light to set the bonding. The next step is to transfer the composite syringe or applicator. This might depend on the type of composite we are using to the dentist, and also transfer the condenser to the dentist so he can start condensing the first increment. Once